shortness of breath? Do you have a restricted like lung disease? Anything like that, right? So that'll kind of further your direction on where to go. So, but the therapies we're gonna talk about. So first we have an IS. This is an ascending spirometer. Have any of y'all seen these? Yeah. Do we blow in or out to these? In. Kind of inhale. So you're gonna be blowing out technically, like. But anyways, right? Am I tripping? Blowing in is. Anyways, we inhale. That's what we do. More of a story, we inhale. So this is more of a preventative measure that we use. So this you'll mainly see with post-op patients. When a patient is post-op, recovering from surgery, they're usually laying in bed. They're not exercising their muscles the way it should, and that goes same with our lung muscles. So this is to prevent for our lungs to collapse because we're, laying in bed at all times. So when your patient is post-op, we'll actually have them do this certain amount of times of the day, kind of check in, coach them, hey, are you doing this? So the way it works, the mLs is based off of your body weight and then your height. And then this little folded rectangle, you should keep it within this small little rectangle when you're inhaling. So you want to empty out your lungs a little bit, and then you're going to take a deep breath in, and then reach your goal. So I put the goal to 1250. This is just a filter, and then we're going to... It's very tiring, but at all times it should remain here. If it's too low, you're not really putting in much effort. If it's too high, you're sucking in too hard, so it'll go like, and it shouldn't be like that. You're not properly expanding your lungs that way. So y'all can take out your filters. The smaller part, we'll all kind of go through it, just to see what your patients will feel if they do have an IS.
And you said the 1250 is based on the...
So it's based on their ideal body weight and height, and gender. So if you're a female, typically we're told to do less, and then male is more. For some reason,
Can I put it right side?
yeah, you put it right. You can hold it. Yeah. And then you're gonna want to keep that little yellow tab in the rectangle. You can do it, 1250, yeah. So when your patients can't reach their goal, you want to encourage them, you want to coach them. Keep going, keep going, keep going, almost there, almost there. Keep going, keep going, going, almost there. There you go. And you want to make sure your patients do it, every time they do it, practice 5 to 10 times, just so they can keep expanding. So, and then when you are checking in, just ask them, hey, are y'all doing it? Type of deal. Harder than it looks, right? Yeah.
Does it go all the way in?
You should no, you can do it like that. Yeah, you inhale, deep breath, let your air out first. Inhale. Yeah. There you go. So you want to first start off inhaling slowly. So you see how it went up all the way up? You sucked in too hard. So try slowly. There you go, a little bit more. Keep going. Almost there. Alright. So yeah, that's how you properly do it. And sometimes when they're post-op, they still feel weak, so sometimes you want to set an achievable, more realistic goal, maybe 750 or 1,000.
So you said inhale and then exhale, and after exhale you inhale.
So you can just
Exhale and then
empty out your lungs, and then you inhale. There you go. It's harder, it is.
There you go, 3 questions. I said, see, I got something to say. It's time for you to retire. I'm tired.
Hi.
Sorry.
Good, how are you? You guys are up here today too?
Yeah.
All right.
Blow out first. Yeah, blow out first. That helps. Exhale all the air out your lungs and then do it.
There you go. Keep going, keep going, keep going. There you go.
Come on, there go your questions right there.
Yeah. I've been doing it. I'm like getting more and more lightheaded. I'm like, okay.
Y'all already supposed to know.
That's what he said. That's what he said every day. James already taught you this.
I keep trying to, I told him not to say that,
That's all
anymore.
he said. Yeah.
He still
You
does.
gotta reteach it.
Cause she asked him.
How do you calculate the number in the middle again?
What happened?
How do you calculate the number?
So it'll be, there's like a chart. You don't really necessarily have to calculate it. It'll be like off of your ideal body weight, and with your ideal body weight, that's with height. So you'll take like your height in inches, depending female or male, and that calculation kind of varies.
Does that correlate with our BMI?
No, I believe that's not. But yeah, because your mass index is more different than your ideal body weight.
That's what I did.
Because it'd be like off of like kilos.
But it's, but it's because it's a calculation, but.
You don't have the chart here?
I can pull it up.
I think they do it.
There's a chart.
I'm just observing.
Yeah, so typically with like lung measures, you'll take into account 4 things: race, age,
You
height,
need to reteach y'all stuff
and
because
sex or gender.
you can't do that anymore.
I mean, my grandpa came over yesterday and they gave him an IS, but they was about to have surgery. And I looked it up and he should be at around 1,500 because he's 70 years old and he's about
Then
5'11".
he stresses that y'all got it wrong.
On the chart, it's like, it goes,
No, but it's something y'all.
it increases in age.
Y'all didn't do it. Your height anymore. And it's just,
So it'll go by ages and years and then height.
And sex too, I think.
So if you know your height in inches,
and I will, again.
go to your age and then you can kind of see if you could attain that goal just off in general.
What do you call the chart again?
It's called predictive nonogram inspiratory capacity. You get on the top.
You can look at the
Yeah,
incentive
the-
barometer graph.
I said, man, I'm going home. I ain't got time to sleep. It's the gaslighting.